Hello and welcome to this channel. If you're joining us today, we've been learning cardiovascular conditions. So today we are going to talk about angina. Angina is chest pain that happens when one of the heart blood vessels is blocked and temporarily deprives the heart muscle of blood and oxygen, causing chest pain. If you feel like your heart is being squeezed when you are stressed or having sudden pain in your left arm, you may be experiencing angina. Blood flow to the heart is blocked due to atherosclerosis. Atherosclerosis is plaque deposition in arteries, making them to become hard with thickened walls. This restricts blood flow and oxygen flow to the myocardium. There will be chest pain resulting from myocardial ischemia. If blood flow remains inadequate, it can lead to necrosis of the heart muscle and finally myocardial infarction. As we continue looking at angina, let's see different types of angina. We have stable angina, unstable angina, and variant angina. Stable angina is also described as exertional angina because it occurs due to exertion or stress. The cause is inadequate blood supply. The pattern of onset and duration is stable. On ECG, there will be ST elevation and or T wave inversion. There are no changes on ECG at rest. For the unstable angina, also known as pre-infarction angina, the cause is inadequate blood supply. It occurs due to stress. There is increased in severity. There is increased in occurrence and severity over the course of time. On ECG, there may be ST depression, ST elevation, and or T wave inversion. And just like stable angina, there are no changes on ECG at rest in the unstable angina. The other type of angina is variant angina. This occurs due to spasms of the coronary artery. It can occur at rest. It is the atypical angina as pain can occur without exertion or stress. On ECG, there can be ST elevation. Let us now look at the risk factors of angina, and here we group them into two: non-modifiable and modifiable risk factors. These are age. There is increased risk with age. The average age in US is 68 years. Second is sex. More men are affected than women. The third one is family history, and this means the first relative with myocardial infarction before the age of 55 years for men and 65 years for female. Then we have modifiable factors. These are factors that we can change or intervene, and these are like cardiovascular disease, where we have hypertension and dyslipidemia. We have lifestyle changes like obesity, physical inactivity, and smoking. Another factor is diabetes mellitus and chronic disease. Now we continue with the diagnosis of angina. How do we diagnose angina? Number one, we do an ECG, an electrocardiogram, and this is usually normal in 50% of clients with chronic angina. We also diagnose angina through history and physical examinations. There are lab tests that you can also do to diagnose angina. There is exercise tolerance test, what we normally call ETT or stress test. Here, an ECG is used to visualize the activity of the heart during exercise to detect angina. Then you can also do coronary angiogram. And in coronary angiogram, a dye is injected through a catheter to view the coronary blood flow. We now go ahead and look at signs and symptoms of angina. We have common symptoms. such as shortness of breath. There will be dull substernal pain, and this pain can radiate to the jaw, the shoulder, and the left arm. You will have pressure and a lot of discomfort. This pain gets worse with exertion or stress, and it improves with rest and administration of nitroglycerin. We have other atypical symptoms such as vomiting, weakness, and fainting, and this fainting commonly occurs in elderly and diabetic clients. Now we look at the intervention for the angina. We have pharmacological intervention and other additional intervention. Pharmacological intervention involve nitroglycerin. This is a drug that is used in acute episodes of angina. It promotes vasodilation of peripheral blood vessels and coronary arteries. We have antiplatelet agents. They prevent platelet aggregation. Examples are like aspirin and clopidogrel. You can give anticoagulant agents. They prevent clot formation. Examples are like heparin and warfarin. Angiotensin converting enzyme inhibitors. We call them ACE inhibitors. They reduce heart contractility and cardiac output, hence lowering oxygen demand. Example, we have enalapril, lisinopril. Then we have angiotensin receptor blockers, ARBs. They reduce cardiac output and heart contractility. We know examples like rosartan, cadesartan, valsartan, azilsartan. All those are angiotensin receptor blockers. We can also give beta-adrenergic blockers. We know they reduce the heart rate, force of contraction, and lower BP, which decreases oxygen demand. Examples of these beta-adrenergic blockers are like atenolol, metoprolol, propranolol. Finally, we can give calcium channel blockers. They increase coronary vasodilation by blocking influx of calcium to increase oxygen supply. For example, we have nifedipine, amlodipine, diltiazem, veramapil, felodipine, nicardipine. All those pins, they are calcium channel blockers. Additional intervention for the management of angina include lifestyle modification, and this reduces risk of myocardial infection and prevents future angina. They include 1. Maintenance of healthy weight to prevent obesity. Then you have to undertake dietary changes. You decrease intake of saturated fats and cholesterol. Another important thing is smoking cessation and also physical activity. In summary, angina is chest pain caused by an imbalance of myocardial oxygen supply and demand. The risk factors include sex, age, family history, and lifestyle behaviors. Diagnosis achieved through history, physical examination, and lab test. You can do an ECG, exercise tolerant test, and a coronary angiogram. Uncontrolled ischemia can lead to myocardial infarction. The first line treatment is nitroglycerin. We have also seen that there are other medications that can be used to control angina attacks. Thank you very much for watching this video. We have more videos coming for you. Check out on our YouTube channel. Thank you.